welcome to listeners to the Ayurveda Network BHU. Myself, Dr. Rajkala Panchakshari Patil, Associate Professor, Department of Panchakarma, BHU. Today I am going to discuss the point that is Yapana Basti, the potentials of Panchakarma, and the content of today's lecture will be what is Yapana Basti, what is the Charaka's views about Yapana Basti, scientific aspects of Yapana Basti and clinical approach to the Yapana Basti. So first, what is Yapana Basti? The text it says, Ayusho Yapanam Dirgha Kalanuvartanam Kurvanti iti Yapana Bastiyaha. So the Basti which support the life and which promote the longevity is called the Yapana Basti. The speciality of this Basti in Panchakarma is, this is the Sarvakala Deya Basti. That means this Basti can be practiced at any time to the anybody or routinely for other Bastis which are there classically mentioned in the text or which we are practicing nowadays. There are many restrictions or routinely there is a specific time to administer that Basti. Routinely madhyane kinchit avarte is the time of administration. That means after the morning hours ends and afternoon starts, that time usually we administer the Basti. But this is the speciality of Yapana Basti. It can be administered at any time in any season. Sarva Rutushu Yogi Kaha. So routinely Lekhana Basti we never practiced in the hot season or in the summer season. But this Basti can be practiced in the all season like spring, summer, monsoon, autumn, winter, pre-winter. In all the season, this Basti can be practiced. So that is the speciality of this Yapana Basti. In text, in the Siddhisthana 12th chapter, Charaka has explained the 216 yogas of Yapana Basti. In that, he has explained 29 original yogas and 187 extended yogas. He explained the general characteristics of Yapana Basti, things to be avoided during Yapana Basti, and complications and management of Yapana Basti. In Sushruta, the views of Yapana is mixed with Niruha. He says, Tasya Vikalpo Madhutailika. That is the Vikalpa of Madhutailika. Madhutailika is the Vikalpa of Niruha. Tasya Paryaya Shabdu Yapanu. And its Paryaya is Yapana. So here the Paryaya is in the terms of their action, not ingredients. So Madhutailika and Yapana has the same action, not the ingredient. So what are the indications of Yapana in classical text is Swasthanam, means it can be practiced for the healthy being. Aturanamcha, it usually can be practiced in diseased personnel also or subjects also. Vruddhanamcha, it can be practiced in the old people also or geriatric age group also. Shodhana Basti cannot be administered in the old age. So this is the exception of this Yapana Basti which can be practiced in the elderly subjects also. Ati Vyavayashilana, those who are the persons who are habitual to sexual intercourse, more sexual intercourse, for them also this Basti can be practiced. Or where we are expecting or enhancing for the enhancement of the Shukra quality and quantitatively, this Basti is the choice of drug or choice of Basti. And to empower the Mams Dhatu, these are the indications of preventive, promotive and curative of Yapana Basti. And coming to the clinical indications, these are the textual indications. Clinically, we are practicing the Yapana Basti in degenerative osteoarthritis, rheumatoid arthritis, convulsions where it is non-focal cause, multiple sclerosis, migraine, in some gynecological conditions like in normal menopause, in premature ovarian failure, thyrotoxicosis, polycystic ovarian disease after Shodhana only to normalize the sex hormone, primary infertility where there is AMH and FSH is abnormal, secondary infertility. In all these conditions we use the Yapana. In male sexual diseases like hormonal imbalance when there is testosterone is less or when there is semen abnormalities are there, or if there is hypogonadotropic causes for the infertility, we practice the Yapana Basti. Other indications are macular degeneration, tremors due to anxiety, alcohol withdrawal, Bell's palsy. Whenever there is recurrence of Bell's palsy, or in Ayurveda it is told like it's a Vega Avastha of Ardhita comes, we practice the Yapana Basti, or Yapana Basti is indicated in that condition. Trigeminal neuralgia after the Shodhana, this is the condition where we can have a better result with Yapana Basti. Visual defect, we usually add the Yashti Madhu in the Kalka, and the conditions where there is atrophic or degenerative changes or infarctive lesions are there, the Yapana Basti is the choice of Basti. Other indications are coma, if might be because of the hemorrhagic injury or infarction or post-operative coma. In such condition where we cannot practice other Panchakarma, Yapana Basti can be easily practiced, or without any complication, Yapana can be practiced in such patient. Where when there is loss of hearing, sensory or neural, old age due to old age, Paget's disease, post-viral infection, Parkinsonism, primary or secondary Alzheimer's disease, or normal pressure hydrocephalus, this is the choice of Basti. Other neurological indications are motor neuron disease, any prolonged systematic illness, progressive muscular atrophy, primary muscle disorders. When it confirmed with EMG or Guillain-Barré syndrome, post weakness, in such conditions, we usually practice the Yapana Basti. There are some contraindications, though it has told it can be practiced in all the seasons or for all the patients, but there are such contraindications for this Basti also. It cannot be practiced in the congestive cardiac failure, nephrotic syndrome, diabetes, TB peritonitis, carcinomatosis, pregnancy, obesity, edema, Cushing syndrome. These are the conditions where kapha is more, or in Sushruta it already told like Kushtashopha Pramehana Avashyam Astapet Na Kadachit Anuvaset, because as this is the Basti is more Bruhana type, so it should not be practiced in these conditions. Other contraindications are infective pathologies, gastritis, duodenal ulcers, pancreatitis, renal calculi, appendicitis, ectopic pregnancy, hepatitis, fissure or fistula, or depression. These all are the contraindications, clinical contraindications for the Yapana Basti. Coming to the potential of Yapana Basti, it has been written in Charak Siddhisthana that the Yapana Basti is Sarva Roga Prashamnaha. So it cures all the diseases. Sarva Rutushu Yogika. It can be administered in all the season. Narinam Aprajatanam. It bestows the child to the childless. Naranam Cha Apatyadaha. It can be used in the male infertility also. Ubhayartha Karaha Drushta Sneha Basti Nirhoyaha. So it performs both the functions of Shodhana and Snehana, which is done by Niruha and Sneha Basti respectively. So superiority of this Basti is, it is na ati snigdha, na ati ruksha. That means it is a Napusak Basti. It is Napusaka is not in the negative sense. It is both. It bears the Shodhana Basti properties and Snehana Basti properties. That's why it is called as a Napusaka by Dalhana. So in the practice of Yapana, in many centers or in many institutes, the Yapana Basti usually practiced with Anuvasana, but Ashtanga Sangraha explain that as this Basti is Niruha Lekhana Prayo, Bruhana Sneha Bastiyaha, Yapaneshu Ubhayam. This Yapana Basti does the Niruha and Sneha both works. Tasmat na ishtateshu anuvasanam. That means there is no need of anuvasana in between the Yapana Basti. So there are the most favorite or most practically used Yapana Kalpas or yogas are there in the Charak Samhita, that is Mustadi Raj Yapan Basti or Mustadi Yapan Basti, which is known as a Raja, king of all the Yapana Basti. Shala Parnadi Yapan Basti, Sahacharadi Yapan Basti, Brihatyadi Yapan Basti, Hapushadi Yapan Basti, Madhu Tailik Yapan Basti, Raswa Panchamuladi Yapan Basti, Tritiya Baladi Yapan Basti, and Chaturtha Baladi Yapan Basti, which usually we use in the clinical practice as a Yapana. So what is the preparation of Yapana Basti? There is some speciality of preparation in Yapana. Usually we add the rock salt and honey at first, then we add the sneha, and after that we add the kalka, and last we add the decoction. But in Yapana, usually the decoction is made up of Kshira Kashaya or medicated milk is usually used as a decoction, and Mamsarasa is added as avapa after the decoction. Okay, so this is the speciality of preparation. These are the studies which already has been done on the Yapana, and it is published study. This is the clinical study on efficacy of Rajyapan Basti and Baladi Yoga in motor disability of cerebral palsy in children. The work is done by 𝐿 ma'am, and the result shows that Mustadi Rajyapan Basti along with Baladi Yoga provided a significant improvement in all the parameters and has promising results in managing motor disabilities of cerebral palsy in children. The another study is on the role of Rajyapan Basti with reference to Duchenne muscular dystrophy, a review which is done by Abhenayake Pemadasa and et al. The third study is on the clinical efficacy of Erandamuladi Yapan Basti in the management of Katigraha, which is done by K.P. Damayanti Fernando in the Jamnagar, and the result shows that it is highly significant result were observed and improvement in the cardinal symptoms of Katigraha was observed. It also provided highly significant result in improving Obesity Disability Index Scale, range of movement, and pain intensity. This procedure appears to provide good clinical improvement in the pacifying pure Vataja and Vatakafaja type of Katigraha. The another study is done by Gaurav Balal and et al. On the effect of Brihatyadi Yapanabasti and Shivalingi seed powder in the management of female infertility due to anovulatory factor, an open label randomized clinical trial. And the conclusion of the study, it was conducted that Brihatyadi Yapana Basti is more effective in the follicle growth, ovulation, and also achieving conception after that Shivalingi seed powder orally. So in this study, the material and methodology of the study was in group A, Brihatyadi Yapana Basti 400 ml was given for the 15 days for 2 cycles, and ovulation was found in the 80% of the patient and conception was positive in the 26.66%, whereas in second group where Shivlingi seed was given, ovulation was and that too was for the 2 months, continued 2 months, and the ovulation was found only in the 64.28% subjects, and conception 0% conception was observed in this group. That means the Yapana Basti is having better effect on the conception also and ovulation also. The another study was done on the Ayurvedic approach in the management of spinocerebellar ataxia. It was done by Dr. Sarvesh Kumar Singh, and it shows that Baladi Kshira Basti with Ashwagandha Tailanuvasana for 30 days in Karma Basti, along with a combination of Ayurvedic oral drugs, give good relief in the dysarthria, fasciculation, heaviness in eye, blurred vision, axial tremor, and constipation and quality of life were observed in that case. Another study was done by Ashwini et al., and it was on efficacy of Rajyapan Basti in Janu Sandhigat Vata with special reference to osteoarthritis of knee joint, and in that study it shows that Rajyapan Basti showed effective result in reducing the symptoms of osteoarthritis. So after this researches, there are in the text there are some contraindications are given for the Yapana Basti also, that is Vyayamo Maithunam Madhyam Madhuni Shishirambucha Sambhojanam Rathak Shobho Basti Steshucha Garhitam. These all are the contraindications during Yapana Basti also. So the exercise, intercourse, alcohol, cold water, traveling, this should be avoided during this Basti, and Though they have done the stuti or it has written that this is very effective basti, it can be practiced for all, but there are the complications mentioned for this basti also. शोफ अग्निनाश पांडुत्व शूल अर्श परिकर्तिका स्युः ज्वर अतिसारश्च यापन अत्यर्थ सेवनात्, as it contains the kshira kashai or medicated milk decoction. It usually, when we give it for the longer duration, this complication occurs, or we have observed in some cases there, after the long-term use of such Yapana Basti, it produces colic pain, indigestion, anal irritation. It's seen immediately, and features of shofa or edema are seen as a long-term side effect of this Basti. So the management is also explained. Routinely, we manage these complications of Yapana Basti with Arishta Prayoga, Kshira, or instead of Kshira, we usually give the Kshara, Sidhuadi, or Deepani Kriya we use for the Ati Yoga of Yapana. The practical tips for Yapana practice. Usually, when we prepare the Yapana Basti, because of the, if the Kshira Paka become cold, and as usually we add the grita in the preparation of instead of sneha, we add the grita in Yapana Basti. When we add this milk kashaya, it becomes the pudding in the cold season, or in a place where it is very cold environment, it becomes the pudding. So the precaution should be taken by the physician that whenever we add the decoction, it should be warm or hot to avoid the pudding of basti, of Yapana Basti. And it should be practiced in the, though it is written or it is told like it can be practiced at any time, it should be practiced in the morning hours only. The dose of Dravya in Kshirapaka, it should be calculated according to the Prakriti constitution of patient, disease of the patient, or what, how much Shodhana and Bruhana we expect in that person. Or if it is the summer season, the dose of Kshirapaka should be less. Or if it is a Mrudu Koshta in the Pitta Pradhan patient, the dose of Kshirapaka should be less. Otherwise, it may create the more loose stool, or it may create the Ati Yoga also. Adding of milk for Kshirapaka, means it happens sometime if the drugs which we are prepared for decoction, if it is not cleaned properly, like Panchatikta Basti when we are preparing, and if that drugs are not cleaned properly, when we add the milk after Kashaya, it becomes the curdling. So to avoid this, the precaution should be taken at this initial stage of the kashaya preparation, that the drug should be cleaned properly, and in the pan where we are preparing, or vessel in which we are preparing the kashaya, it should be clean, and there should not be any like sour taste, or any uh, lemon or anything should not be there, to avoid the curdling of the basti. The preparation of basti in mortar, it should be practiced when there are more bastis in the theater. Usually they prepare with the mixer. This should not be done for the Yapana Basti. It should be prepared in the mortar. Administration of Basti, which is usually we administer in the Niruha, the same administration should be followed for the Yapana Basti also. It should be empty stomach. It should be given in the morning hour, and after post-operative also the same like Niruha Basti. After the uh, evacuation of Basti, the warm water bath and light diet should be provided to the patient. It is the same like hot water bath, light food in the Pitta Prakriti, and assessment for the effect and complication should be done immediately and after every day. Thank you for the patient hearing.